Hey guys, this is Jay Patel from MyFitMed. So we have talked about benefits of testosterone replacement therapy. There are a lot of benefits of testosterone replacement therapy, but sometimes we see patients comes in and say that their symptoms are not improving even after starting testosterone replacement therapy. So there are certain things that we have to check, and there are certain reasons why your symptoms are not improving. One, when you just initially starting out testosterone replacement therapy, and if your estrogen is too high, you won't feel your very best, or you won't see the improvement in your symptoms that you came in for. You'll see that you're retaining a lot of water, you're feeling bloated, puffy, you gaining weight, you'll feel worse than what you felt before starting TRT. And it's a simple fix. You start an estrogen blocker, it brings the estrogen down, and you start seeing the improvement. The second thing a lot of time patient tells me is weight gain. So once you start the testosterone replacement therapy, you have to start exercising a little bit. You have to start utilizing the testosterone. So you start adding more lean muscle. If you don't do that, you'll start retaining again a lot of water that will convert to estrogen, and then you won't see the improvement in your body composition the way you thought about it, or the way the TRT would improve. The third thing is increase in hemoglobin. One of the common side effects with testosterone is increased hemoglobin. But what happens if your hemoglobin gets too high? Your blood flow is not as good, and you actually start feeling tired. You start feeling worse than what you felt before TRT. Now, there's a couple ways to manage this. You either lower the dose of testosterone, or you donate blood to keep your hemoglobin in a normal level, so you see the benefits of testosterone replacement therapy. The fourth thing is, if your levels are not high enough, because initially when you start TRT, most of the doctor will start you on low dose and slowly titrate you up. So if you are on your titration dose and if your levels are not high enough, you won't see improvement in all the symptoms, or you won't see overall improvement. And this is the one that we have seen in some patients, is too high of the testosterone. So if your levels are too high, you'll actually feel worse than what you were feeling before you start the TRT. So too high of the testosterone is not very good either. There has to be an optimum level where you feel your very best. So recently we had a few patients that came in and they weren't feeling their very best. We did the lab test, everything was okay, their hemoglobin was good, estrogen was good, but their testosterone was too high. We lowered the dose of testosterone, and they actually start seeing improvement in their symptoms. So remember guys, when you are doing TRT, more is not always better. So make sure you are following up with the medical provider. Make sure you're getting your levels tested. Even if you're on TRT for a long time, you still want to make sure that you get a regular lab test done, you get your level tested, and follow up with your provider to make sure that you are being optimum.